my district and in this country believe otherwise. I think the American people want to make sure when we're talking about safe vaccines and we're talking about the FDA and we're not shortcutting safety and those kinds of things, I don't know how in the world that we can stand there and say, no, I don't think China's a threat to the vaccine production in this country when we just indicted 2 people, and not just 2, but I think that question is so important, Madam Chairwoman. I think it's so important. I want to re-ask my question. I see our chairman's not here, but to you, Madam Chairwoman, I think we need to investigate that answer on cybersecurity. We've already indicted more than 2 people, but just 2 people in the last couple of days ago. Why can't we have a hearing in here? And I understand the chairman has said before, well, there's other committees having hearings on the role of China, but nobody's having a hearing on the role of China versus the producers in America and the vaccine process that we're looking for, the heroes that are trying to save lives. That would be appropriate for this committee. Can we get a commitment? Can I get a commitment from you sitting in for the chairman that we will actually have a hearing and look at this?
This committee is chaired by Mr. Clyburn.
Right now it's chaired by you, madam.
I do not intend to give you an answer to a question about how to run this committee in his absence. You may address him when he returns, not me.
I appreciate that answer, and I will, but I think for the record, I think we still are owed an answer as to why we can't look at that in this committee. There's no other committee set up to look at the vaccine process of oversight than this one, especially having you gentlemen here today. So I would yield back my time and add that for the record. Thank you, Dr. Fauci.
Who do we have next coming? Foster. Foster. Can't do it. Mr. Foster, you are now recognized for 5 minutes.
Oh, thank you, Madam Chair, and to our witnesses. Well, first off, I'd like to second the comments of my colleague, Representative Dr. Mark Green, on the letter that was recently sent from this committee providing for ongoing real-time bipartisan oversight of Operation Warp Speed by the Government Accountability Office, the GAO. With Dr. Green and myself as the bipartisan points of contact, directing the GAO of points of interest to the committee. In my time in science, I was involved in billion-dollar research projects that were subject to GAO oversight. They would bring in outside experts, they'd ask hard questions, and they report back to Congress the truth as they see it. Both from a technical and scientific point of view and also a project management point of view, which can often be critical. GAO is fastidiously nonpartisan. They will give us real-time briefings, staff briefings and member briefings, and periodic reports on the progress of vaccine and therapeutic manufacturing under Operation Warp Speed. But they will only give us briefings on a bipartisan basis, which I think is very valuable, because it will be crucial that people believe when vaccines and therapeutics become available that the process was not politicized, that we actually have bipartisan agreement that reasonable decisions, free of conflicts of interest or political intrusion, are being made. And the GAO is intent on not becoming a tool for partisan advantage, which really helps our government work better. So an example of the sort of thing that I'm interested in having them look into is something I was discussing with Dr. Redfield over the break, which is a monoclonal antibody therapeutic manufacturing. There's a lot of the good news is that there is, in fact, a strong immune response to this virus by the human immune system. This means, among other things, that vaccines are more likely than not to work, and it also means that antibody therapeutics are more likely than not to work, as they have against recent viruses. So we may be in this position where, there's a miracle cure that can then prevent or cure COVID-19, but we do not have the manufacturing to meet the demand, especially given the ongoing flare-up of COVID-19 in our country. And so that you can imagine the politics of that will become extremely fraught rapidly when we have to decide how to dispense this potentially life-saving therapeutics. And so it's also a circumstance in which aggressive project management may be crucial. You can imagine if you want to produce the maximum number of antibodies, you may say, okay, we are going to choose the most effective antibody from company A. We are going to produce it using the optimized cell lines from company B, and we're going to use the high-volume production equipment on Company C. This will require things like the Defense Production Act being used at their fullest to just leapfrog around issues of things like intellectual property. Already the companies that are optimizing cell lines are getting into patent fights and so on. We don't have time for that. And so one of the things I'd like the GAO to look into is to make sure that we have in advance the sort of project management, that the contracts that are being made with all of these companies anticipate this, or that discussions for the applications of the Defense Production Act, are actually taking place ahead of when they'll be needed. It's just one of many examples there. And so I just want to encourage, both of you and HHS generally to greet with open arms the GAO oversight. They can, it's not always fun being subject to GAO oversight, but their questions actually make the projects better. And so also, I think you've probably been involved with projects that have been involved with GAO oversight, and so there's a career-long association of the GAO personnel and the agencies they represent, and so that it's not like you're getting a letter from Congress where you kind of roll your eyes and try to do the minimum. These are serious questions by professionals. So when Dr. Green and I intend to use that to provide real bipartisan information to this committee and to Congress and to the American people about what's really happening, and I think that will be crucial. So any of you, do you have any comments on other things that we can do to really make the public confident that the right decisions are being made for the right reasons in this?
Well, thank you for that, Congressman Forster. Yes, I mean, the fact is that we are very transparent in what goes on in Operation Warp Speed. I have been...
Well, but there have been public comments by the scientists, the active collaboration, which was set up by HHS. Some of the scientists involved in that said, I have no idea what's behind one of the Operation Warp Speed decisions.
Right. So in direct answer to your question, I think you brought up a good point about the monoclonal antibodies. We didn't get an opportunity to mention this in any of the questions, but monoclonal antibodies, just this week, there were 2 trials that have been initiated, one on an outpatient basis for early patients, one on an inpatient for more advanced patients, which we really have a lot of anticipation that is going to be something that is going to be an important tool in the armamentarium of how we treat COVID-19 patients. So I wanted to get that in because I think that's really important. Regarding the scrutiny of a GAO or otherwise, I have been, in the many years that I've been doing this, had many GAO looking into the things I've done. In fact, I have found it in many respects very helpful.
Thank you. Yield back.
Gentleman's time has expired. Ms. Velasquez, you are recognized for 5 minutes.
Thank you, Chairwoman. I want to get back to the delays in testing. Researchers at the University of Pennsylvania recently found that testing sites serving communities of color in big cities are fewer in number, have longer lines, and often run out of tests faster when compared to sites in wider areas in those same cities. As former Federal Reserve chairs Ben Bernanke and Janet Yellen told the Select Committee, nothing is more important for restoring economic growth than improving public health. Yet we have the president that says, slow down testing, please. And the most vulnerable among us are being impacted. Frontline workers, small businesses that cannot reopen safely, and Black and Latino populations. So I have some questions along these lines. Dr. Fauci, I have a simple question for you. Do you attribute this inability to control the virus to the delays in testing and contact tracing?
Thank you. Control of the virus is clearly a multifaceted process that involves many things, the most important of which is what we were just speaking about before, about testing, about masks, crowds, outdoor versus indoor, distances, et cetera, et cetera. We've been through that multiple times during this hearing. Testing is a part of the process, but the process of controlling infection When you're talking about contact tracing, obviously you need testing, and you need testing back within a reasonable period of time. And the concern that you're expressing is for the days that it takes, and Admiral Giroir has addressed that several times during this hearing. But testing is a part of the comprehensive approach, not the only thing,
Sure.
but as part of the approach.
Thank you. South Korea had rapid results for testing and tracing, and the virus is essentially contained there or gone. Do you agree that what they did with respect to testing helped those countries get the virus under control?
Virus and the control of some of the Asian countries were due to a number of factors. Their ability to shut down almost completely, as I mentioned in a remark before, to the tune of 90+%.
Did they rush to reopen the economy?
No, they shut down. They had the capability because they got down to a very low baseline to do adequate identification, isolation, and contact tracing. Right now, they are trying to reopen. It's going to remain to be seen how successfully they do that.
So, for the record, does testing result in the U.S. seeing more COVID cases or are other factors causing the spread? Does testing result in the U.S. seeing more COVID cases or are other factors causing the spread? Okay. So, are we seeing more COVID-19 cases in the U.S. because of the testing results?
Obviously, if you do more testing, you're going to see more cases.
Okay.
But the increases that we're seeing are real increasing in cases, as also reflected by increasing in hospitalization and increasing in deaths.
Why is that professional sport leagues can get testing turnaround times within 24 hours, but we cannot do it for all Americans?
Well, some of the sports clubs have been using the rapid test, which is really very different from the test that requires extraction of DNA and takes time in a different machine. So they have bought a bunch of machines that allow testing to take place where you get a positive back in 5 minutes and you could declare negative in 15 minutes.
Dr. Redfield, do you support the fact, do you agree with the fact that there is a disproportionate testing going on among Latinos, Black, Native Americans?
I wish the Admiral was here to answer it, but I've heard him answer this before, and Tony may comment, that he has set up disproportionately these testing sites in areas that have indications of more complex social economic status. I don't remember the exact number, maybe Tony does, but more than 70% intentionally trying to target areas that may be more disadvantaged. So I wouldn't agree with that statement, but I would like the Admiral to be able to get back to you with the specifics.
So you haven't seen the long lines in the urban cities and also in states where we have large population of Latinos and Blacks?
I've seen the television lines. Mm-hmm. What I was trying to say when you said, was it specifically disproportionate for Hispanic, Latino, or African American or Native Americans? And I'm not comfortable supporting that comment. I would rather get the specific data from the Admiral, which I do think the system has really gone over the other way to try to make sure we've enhanced the community health centers and these federally assisted testing sites in areas that are specifically more disadvantaged.
Mm-hmm.
The gentleman's time has expired. The chair yields 5 minutes to Mr. Raskin.
Thank you very much, Mr. Chairman. And if you're trying to still figure out why the administration and our Republican colleagues cannot formulate a plan of action, look no further than the disgraceful diversions and distractions of some of our colleagues today. I want to address the First Amendment line of questioning first. Our distinguished colleague from Ohio keeps raising, for some reason, the Supreme Court decision in South Bay United Pentecostal Church versus Newton, which rejected his position just about 6 weeks ago in a 5-4 decision. A church said that the restrictions limiting the number of people who could go to church to 100 were perfectly constitutional because that was the exact same rule that applied to lectures, concerts, movies, spectator sports, theatrical performances, political party gatherings, and so on. In other words, there was no religious discrimination taking place, which is why the Supreme Court rejected the claim, and there is no religious free exercise exemption to public health orders, as you were indicating, I think, Dr. Fauci. So the parties in the case cited numerous cases of church gatherings with people unmasked, singing, chanting, and so on, that became super spreader events. There is no religious immunity to this disease, and there is no free exercise exemption to universal public health orders. Now, as for protest, let us not confuse the issue. Whether your protest is a right-wing protest, like Boogaloo and Proud Boys and anti-public health order protesters, like the ones who threatened the life of Governor Whitmer and tried to shut down the Michigan legislature and succeeded in doing so, or it's the nonviolent assemblies of millions of people with Black Lives Matter across the country, the kind endorsed by our late beloved colleague John Lewis, the champion of nonviolence, the same rules must apply. If a jurisdiction has a 6-foot rule and a masking rule, which I assume and hope every one of them does, it applies equally to everybody. And the preliminary results suggest, and I know because I've been to a lot of the Black Lives Matter protests, is people are not getting infected there as much because they are observing those rules. Obviously, when you go to an anti-public health order, anti-masking protests, like the kinds that shut down the legislature in Michigan, most people are not wearing masks and are not observing the public health protocols they've come to try to destroy. So if you're really concerned about the protests and people getting sick there, and we should be, then we have to look at the use of tear gas and pepper spray. Everybody saw the secret federal officers who were assembled by Attorney General Barr in Oregon remove the mask of a naval veteran and spray pepper spray right in his face. That's extremely dangerous to remove someone's mask and then to have them sneezing and coughing and so on. So it's the use of those chemical irritants, I think, which is the real danger. But Admiral Girard, what I wanted to ask you was about the role that Jared Kushner has played in developing the administration's approach to, is he still with us, or is he? Oh, he's gone now. Okay. Well, Dr. Fauci, let me turn to you then. Are you aware of the role that Jared Kushner has played in developing the administration's approach to diagnostic testing?
I have no knowledge of that, Congressman, because I've not been involved in that. It's really been Admiral Girard being involved in that.
Okay. Well, then I'm sorry I missed Mr. Girard in the second round. But yesterday, Vanity Fair reported something astonishing, which is that Jared Kushner recognized that there was no plan, and he formed a secret working group at the White House in March and April to develop a national testing plan, which operated in a, quote, bubble and did not coordinate with other experts at HHS. And they actually came up with a very detailed and potentially effective national testing plan. One person involved said it wasn't rocket science, but it was a real plan in which the government would coordinate the distribution of test kits in an aggressive program of contact tracing across the country. But the White House reportedly dropped the plan, according to this article, how Jared Kushner's secret testing plan went poof into thin air. Okay, the White House dropped the plan on the political logic that the outbreak was going to be limited to Democratic states. This is back in March in New York and New Jersey. And you remember there was a lot of talk about how this was a blue state disease, and there was somehow some kind of political or ideological immunity to getting it. So they thought it would be a better strategy just to pit the states against each other in that vicious free-for-all for equipment and materials, and then blame the governors when everything went wrong. And we've seen the shocking, devastating results of just letting it go and not having a plan at all. With that, I yield back to you, Mr. Chairman.
I thank the gentleman for yielding back. I think we've finished our second round of questions. And I would like to now yield to the ranking member for any closing statement he might want to make.
Thank you, Mr. Chairman. And again, I want to thank our witnesses for coming here, including Dr. Giroir, Dr. Fauci, Dr. Redfield. You're on the front lines, as well as the teams that are behind you working to implement President Trump's plan to combat this virus. In fact, Dr. Giroir left to go address thousands of people who work under him. He talked about 7,000 deployments that have been made under President Trump's command to have men and women in uniform going on the front lines to help at the state and local level. We've seen so much work being done in this plan, and I keep going back to it because I know some people want to deny that this plan exists. Of course, at the same time that they're criticizing components of the plan. You know, part of this plan, again, there's thousands more pages online. This is just a small part of President Trump's plan to combat the coronavirus. Part of the plan included stopping flights to China, which, as Dr. Fauci testified under oath, saved lives. That was President Trump's call. He got criticized from it. In fact, he got criticized from some of the very people who say that he doesn't have a plan, yet they criticize parts of his plan, and that plan worked and saved lives. I know, Dr. Fauci, you testified under oath about some of the other decisions that were made by President Trump, working in conjunction with you and the rest of the team, these respected, internationally respected medical doctors that saved lives. Thank God President Trump keeps his focus on carrying out this plan every day while people are literally trying to disagree with it and then deny it exists at the same time. And so when you look at now where we are with Operation Warp Speed, and this is something that is so incredibly important, working to find an actual vaccine for the disease. And again, Dr. Fauci, I know Dr. Redfield, you talked about this, but I appreciate you giving out the website. Again, over 250,000 Americans have now signed up to be tested for this virus. Might be one of the most tested trials for a new virus in American history. Probably the quickest time that we've been able to get a vaccine for a disease we knew nothing about even 6 months ago because China lied to us. Because China still to this day is trying to interfere with our ability. While we're working feverishly to get the vaccine, China's working feverishly to try to steal the vaccine. We ought to have a hearing on that, Mr. Chairman. I know Ms. Walorski talked about that and brought that issue up. You know, when you look at the incredible work, as Dr. Giroir is doing on testing, to get those testing kits into nursing homes, that's part of President Trump's plan. And in fact, it is saving lives. If those 5 governors who did not follow the federal guidelines would have followed the federal guidelines, again, as testimony under oath confirmed, thousands of deaths would not have happened. I wish they would have followed the guidelines. I wish they'd share the data. They're still hiding the data, those 5 governors. We've asked them. Those of us on the Republican side, if just one member on the Democrat side, Mr. Chairman, would join us in asking those governors to share the data that they're hiding from the American people, they're hiding from the families, the sons, the daughters, the grandchildren of those who died in those nursing homes. They're hiding that data, and they won't give it to us. They said they don't have to give it to us because not a majority of this committee has asked. I wish, Mr. Chairman, you'd join us in asking to get that data. What's wrong with asking for the facts? And so then you look at opening schools. You want to talk about saving lives, and this is one of those untold stories, unfortunately. There are 50 million plus children across America who are counting on us to get it right. The good news is the Trump administration has laid out a plan for how to reopen schools safely. You know, just right here, you talk about school administrators on the use of cloth face coverings. CDC suggests that all school reopening plans address adhering to behaviors that prevent the spread of COVID-19. They go into detail on all the things you should do, as we talked about, washing hands, all of that. You can socially distance. You need to socially distance. You can do it. In fact, you need to do it. But to say you can't do it is a cop-out. This is America, for goodness sake. We put a man on the moon. You can follow basic guidelines. If you don't want to trust CDC, go to the American Academy of Pediatrics, for goodness sake, who put out really good guidelines for how to safely reopen schools. And they went further and said the danger to children You're hurting kids by not reopening schools. As Dr. Redfield testified, the thousands of kids that aren't getting diagnosed with things like child abuse, which is happening, unfortunately, it gets discovered in the schools. That's not happening. The nutrition programs, the mental health programs, there are drug overdoses happening today that wouldn't be happening if those kids were going back to school. You have to get it done, and don't say it's because of money. You can't say it's because of money. Every state in the nation's got money. We put over $150 billion out there. Do you know that based on this list, about $100 billion of money we in Congress appropriated, President Trump signed into law, about $100 billion still available in every state. And this money, without changing law, can be used to provide all of those supplies that the experts said you need to reopen your school safely. It's all there for you. If you run out, give us a call, but the money is there. Don't use that as an excuse. We all owe it to the kids. If there's never been a better time to make the argument for school choice, for goodness sake, you've got some of these unions that are saying they don't want to go back to school. As Mr. Jordan pointed out, they're encouraging people to go to a protest where you're not socially distanced, but they say you shouldn't be able to safely reopen the school, but they want to take the money. How about if there's another school system that's willing to safely educate your child? Shouldn't the parent be able to do that? Why deny parents in low-income communities the ability to have the same choice that other people that aren't in low-income communities have? That ought to be on the table, too, because there are systems all across this nation that have figured it out. Again, you don't need to reinvent the wheel. It's all there in the president's plan. President Trump has laid this out. You can go to the websites to get it. Come call me. I'll give it to you. But it's there. If you don't like it, you put a better plan on the table. Of course, they haven't done that. But in the meantime, don't deny those children the opportunity to seek the American dream that everybody else has deserved over the history of our country. And that's what will happen if they don't follow those safety guidelines and safely reopen the schools. So with that, Mr. Chairman, I again thank the witnesses, appreciate the work you're doing. Wish we could follow up on some of the other issues like Mr. Jordan, police officers that are being attacked right now and being put at risk to coronavirus. We had a hearing in this committee on our frontline healthcare workers, and it was an important hearing. I'd like to see us have a hearing on those law enforcement officers who are being put at risk by the attacks on them that we're seeing all across the country. And then, of course, China, the role that China has played from the beginning, lying to us, hiding information, now trying to steal our information every step of the way. We ought to have a hearing to hold China accountable too. So appreciate the work you're doing. Please continue to go do that. Tell all the men and women that are sacrificing to help combat this virus, working with President Trump. We thank them on behalf of all Americans who want to see us get beyond this and get back to the things that we used to do. With that, Mr. Chairman, I yield back.
I thank the ranking member for his closing statement, for yielding back the time. Let me begin by reminding him that we did have a hearing for essential workers, and if my memory serves, police officers, law enforcement officers were included. They are essential workers.
In relation to the attacks we've seen on them, that's a new development since that hearing.
Well, I suspect that the protesters that my friend Mr. Jordan seemed to be so preoccupied with have had some state-sponsored attacks made on them, much like those that we remember from a not-too-distant past. But this week, a leaked White House coronavirus task force report indicates that there are 21 states in the so-called red zone. And for some strange reason, the report says that they were communicated with privately, and I'm kind of troubled that the administration would hide this from us. And so I don't know that this is not for question, but I'm going to ask Dr. Redfield if he would respond to us in writing on this, because I would like to know whether or not we can depend upon, going forward, these kinds of reports to be made public rather than be issued to these states privately, because it seems to us that while the White House is maintaining a public statement as it relates to this virus, they have been sending some stuff to states privately. And I would hope that this could come to an end. Now, I would also like to say to my friend who seemed to be so concerned about kids going back to school, Mr. Ranking Member, we all want to see our kids go back to school. I'm the grandfather of 2 school children that I want to see in school, though they are privileged enough to have the internet available to them. Their classmates, many of their classmates don't. And therefore, many of their classmates are not going to be allowed to go to the next grade. Those same classmates are going to be subject to losing another year of school. We all want them back in school. But I want to refer, since we are talking about the American Academy of Pediatrics, they have followed us up with us, the American Federation of Teachers, the National Education Association, the School Superintendents Association, they all joined together. One size fits all. We should delegate to the professional superintendents and the principals of these schools to determine how best to reopen schools. We want them to reopen and arm them with all the resources they need to do that. So this whole notion of just telling people to go back to school, that is one thing. Give the principals, the superintendents, the states, give them the resources they need and the guidance they need, and let them work with those rural communities that are different from urban communities, where they don't have the internet available to them and they can't do online learning. And they've got to be able to space. They got to have masks. I represent families that cannot afford to buy masks every day. Many of them can't afford to buy the books. So we ought not be putting that burden on them. And so we have resources up here that we ought to get out to these school districts. And I know, I hear from teachers every day who go in their own pockets to pay for material for their students. That's happening every day. And they're preparing to go back to school with budgeting to do the same thing. Now, before we close, I want to enter into the record. I have another letter from the American Association of Medical Colleges. And I'm asking unanimous consent that this letter be entered into the official hearing and without any objections so ordered. Now, I want to thank Dr. Fauci, Dr. Redfield, and Admiral Jawar for being here today. We appreciate the expertise you have shared as we work to end this terrible pandemic. As we heard today, a comprehensive plan to reduce the spread of coronavirus would save lives. But everyday effective action is not taken, more lives are lost. Today's hearing has made clear that the Trump administration must put aside partisan concerns and work with public health and medical science experts to craft a comprehensive plan to defeat this virus. The plan must prioritize public health over perceived political expediency. The plan must ensure states have the testing they need, give Americans clear public health advice, and follow the advice of legitimate experts like we have here today, even if their assessments are difficult for administration officials to hear. Much of this is inconvenience to the public. Nobody feels comfortable getting up every morning and looking for a mask. Nobody feels comfortable riding around all day with a mask. It's inconvenient for everybody. So it's uncomfortable for everybody. But the plan must include guidance and support for state and local governments, health departments, schools, and community organizations. I come from a part of the country where no education would have been available to my parents had it not been for churches, because the states did not sponsor education for them. My father was not allowed to graduate high school because no high school was available to the students in the county he grew up in. And so we've got to bring local communities in this. The churches, temples, synagogues, all need to be involved in this. This is not excluding any religion. We're trying to bring religious organizations into this effort. And we've got to protect our students and our teachers and not go rushing into reopening schools. Finally, the plan must address the grave inequities this virus has inflicted on minority communities. Our black and brown communities already faced health and wealth disparities before the coronavirus. That's what Ms. Velasquez was getting to in her last line of questionings, particularly when we are dealing with this contagious virus. In the words of Dr. Martin Luther King, Jr., in his letter from the Birmingham City Jail, which I happen to believe, most people may not agree with me on this, but the Bible to me is a timeless document. And I believe that King's letter from the Birmingham City Jail is a very timeless document. He said in that letter, injustice anywhere is a threat to justice everywhere. Dr. King also said, and I quote, in that same letter, time itself is neutral. You may recall, he is responding to a letter that he had gotten from 8 non-black ministers who said to him they agreed with him, but the timing was not right. King in his response says, time itself is neutral. It can either be used destructively or constructively. And then he went on, more and more I feel that the people of ill will have used time much more effectively than the people of goodwill. This destructive virus, while it has no will, has used the past 6 months to spread more than 4 million of our fellow citizens. It spread to more than 4 million of our fellow citizens. To prevent more lives from being lost, people of goodwill, including those who are here today, I consider you to be among the people I respect most in our government. People of goodwill must use their time constructively to combat the virus much more effectively than it has been to this point, irrespective of how many tests we may give, irrespective of how we may shape up to the rest of the world. The question for us is, are we using our time constructively? People of goodwill must correct past mistakes, embrace the science, work together in a bipartisan way to defeat this grave threat to our country. And if I might quote Dr. King once more, the time is always ripe to do right. Without objection, all members will have 5 legislative days within which to submit additional written questions for the witnesses to the chair, which will be forwarded to the witnesses for their response. I ask our witnesses to please respond as promptly as you are able. And with that, this hearing is adjourned.